anything to report on our committee? Chuck, do you have anything?
The budget committee, we need to set up a time to meet. The 2 weeks. What you all are looking for?
When's your first budget meeting?
Don't know.
We haven't set that up.
Haven't set it up yet.
Will it be after your commission meeting then? March the 5th, I think.
Yeah.
Probably, yeah.
So,
Well, I think we could get our basic budget done as soon as we need to. The question is, on the payroll budget, I went to Beckell's office, I got the printouts of all the FICA all the time, and it said, the deputy commissioner, and we need directions from you all, what you want in that payroll budget.
What I was looking for, and I'm basically repeating what I said last meeting, was for you all to look at ways to cut the payroll, or suggestions that you can give to us. I mean, there are no other parameters other than what you can cut.
so you're not actually wanting us to give you any kind of numbers, because those numbers come from Beth anyway.
Well, I think you have to have numbers, but for percentages, and because there's no way that we can come up. Well, so there's no way that we can come up with the numbers, but you all probably are more familiar with the payroll numbers. So, like I say, I'm looking for suggestions on how to.
Can you tell us how the Doddridge County Park would present their payroll budget to the county commission?
What do you mean? How they would?
Well,
They
are you asking the ambulance authority to do something about payroll that you are not asking the sheriff's department and the park and any of the other agencies under the county commission? Are you asking us to do something that they don't normally do?
Yes.
Okay. I thought that you were just asking us to fall in line with the established practice that you already had.
No.
So the Doddridge County Park or Sheriff's Department or whatever, they've never said to you, we need $250,000 for payroll.
I assume that they will in their budget requests that are being presented at this point in time for our consideration during the month of March when we set the budget for the county.
Okay, then I'm still confused because I thought you just said that you weren't asking them to do the same thing you're asking us. But you are. You're asking every agency
No.
now? No.
No.
Then I really truly am confused.
I am also.
I am asking the ambulance authority to give me suggestions. The reason is the payroll for the ambulance authority comprises a very, very significant portion
On the budget.
of the budget. And that's why I'm looking for suggestions from you all.
Well, you're not asking us to submit to you a budget. You're asking for us to submit to you a ways of cutting our costs. Is that what you're saying?
I have a question. How can you put a price on a person's head, on the people of Doddridge County? And all the oil and gas workers that are here too. I mean, you're asking us to put put a price on care for the people in Doddridge County.
Why don't we just say, in case there's 5 calls at the same time, let's have 5 crews? The point that you see, the point here is that, yes, you all have to deal with the care. We have to deal with the care, but we also have to deal with the budget. And to just make the statement that if it was my relative, well, of course I would, in that situation I would say, money is no object. But as county commissioner for Doddridge County, I have to deal with a budget also. So that's what I'm looking for. I'm looking for ways to cut the budget, and I know, and I know that you all are saying you were given the directive 2 full-time ambulance authority or 2 full-time crews, and I understand that. But what I'm saying is we've got to find a way to make this more affordable so that it's not such a large portion of the budget.
We're 20% of the budget, right?
That's, I think, probably a round figure, but it's
I've heard
approximate.
it before, that's why I was curious.
And suppose, what is the sheriff's department?
That I don't know right off the top of my head.
You don't,
I
right?
haven't dealt with that yet. Let me
Do
just
you know,
look.
Tammy?
I'm no mathematician. I know, I can see what he's asking of you all because the rest of the people come in and they have their budgets set up with their payroll already in it. And that's pretty much fixed from year to year unless they ask for a raise for
Well,
a
that's
certain
what we've
person.
done in the past, but
You're
you're telling me you don't want a budget, you want ways, so you don't want us to submit a figures budget, you want us to submit ways to cut our costs. Correct?
I think I might understand a little bit of this, but I think Greg is wanting us to take our budget that we had this year, and supposedly we were going to submit close to the same budget. But instead of doing that, you want us to find ways that we can cut not only payroll, but other things in the budget.
Well,
With money. Is that correct or not?
the primary areas that you all impact the Doddridge County budgets, Doddridge County Commission budget, are payroll and related costs. So that's where I'm.
Related costs being insurance.
Insurance, retirement, those, they all relate to the payroll.
Well, I know one of the things that we talked about after the meeting was over is that there are some problems with the personnel handbook for the county as it relates to our ambulance authority workers, because they work according to shifts that no one else in county government works, except maybe the police department. But if we have a crew that is established to work on a holiday, everybody else was not supposed to work that holiday. But with the way that your handbook is written, everybody else gets paid for a holiday. They wouldn't have normally worked anyway. So that in and of itself, how many paid holidays do county employees get? 7, 8?
There's a lot more than that.
A lot more than that.
Yeah.
So if you take that alone and just make an adjustment in your policy book that states that ambulance authority employees are exempt from holiday pay, because they're not supposed to be working it anyway.
Unless they work it.
Yeah, well, if they're working it, they're gonna be.
Right, but you can't say
Right.
they're exempt, just the ones that aren't working that.
Right, okay. But I mean, there's a way that you can work that out, so that there's a whole bunch of people on, I don't know, how many employees do we have, 22,
Something like
25?
that, like 25, I think, something like that.
You know, so if you figure it's a holiday, there are 2 crews, that's 4 people.
But I think you'll need to check with Beth. I think we've revamped that a good bit, and I don't think that she's paying the employees that are off the holidays, because we talked about that.
Well, that's
So I
something,
think
that's
we need
something
to
that
check
certainly needs to
We
be
talked,
checked.
we talked about that at one point, because, I mean, you know, they get off for Black Friday, they get off for all kinds of different holidays, because it's courthouse holidays. And we talked about that, and I don't think all those are covered for the ones that are off. Now, the ones that are working, yes, they've been receiving the holiday pay, but the ones that are not working that day, I don't believe are receiving the holiday pay, because we cut that ourselves so that we wouldn't have that expense for the county to pay that. But I think we had to get to Beth to make sure, but I'm pretty sure that we're not paying that holiday pay for the ones that are off. Just the ones
Let me
that
ask
How
you-
long has that been cut out, you know?
are a while.
Let me ask you a question.
Well, that certainly needs to be verified, because that could have a
I'll call Beth
substantial
tomorrow.
monetary impact.
Every 2 weeks, I get a payroll figure from Beth Keller emailed to me. It is the gross payroll figure that I work with to look up and down what it costs. Last week, she gave me a printout of what the FICA costs are, which is our social security, and what the retirement costs are. I asked her, what is the cost of the health insurance? She tells me that it's something that is a group, it's billed as a group, it's not billed as employees. So if we are, I've got the numbers here, what we're going to use on FICA, and what we use it on, I take an average, of what we're using on retirement. So if we're going to cut these dollars, we're going to have to cut services. That's basically what it boils down to. Or we have to increase income.
Well, I know one of the things that I looked at was I had Randy to print off reports that showed the hours of the day and the runs associated with those hours. Because one of my ideas was, well, maybe we can block out a 6 or an 8 hour period of time where we have relatively no runs, and then we could actually cut payroll back looking at that. Well, it just didn't work out that way. And that's one of the issues that you're going to be dealing with, is you never know when someone is going to have a 911 call. Now, the other thing that we have talked about and looked at, and it's been of great public concern, was the transports. You know, so if we're running 2 crews 24/7, then if we have an in-county person who needs a transport, or a hospital patient that needs a transport, it would need to be carried by the 2 groups that are already on for the day, and there not be an extra crew that comes in to take care of that service. That's one of the options. But how that's going to monetarily impact payroll, we would never know, because we don't always know, you know, what the call volume's going to be and what the transports are going to be. So numbers aren't going to be easy to be able to say we can reduce by 5%, or we can reduce by X hundreds of thousands of dollars, or just hundreds of dollars. But those kinds of suggestions, we can say, you know, we will look into the holiday pay issue. If there's any other benefit issue that could be adjusted. You know, you all would need to look at the handbook to say, can we make this adjustment for the ambulance authority? I mean, we could work on those kinds of things together. But Greg, it's gonna be awfully hard to just say, we're gonna reduce by 2% or 5% or 10% or whatever. We can target that as best as we can.
Well, if you recall, last meeting, I said that what I wanted you all to do was give me suggestions. If you see that certain things are going to be impacted, then that's part of your suggestion. And I left it up to you all to come up with the suggestions as far as how you're going to accomplish this. And I guess it boils down to this. If you give me suggestions, we will consider those. If you don't give me suggestions, then we'll make a decision based on what we have.
Okay, so do we need to like officially say, okay, write down number one, you need to look at the benefit package, and you need to look as far as holidays, paid leave, those kinds of things and how it relates, and check with Beth to see, as Randy has suggested, maybe there's already been adjustments made there. But if not,
That can be a suggestion, yes. You know, I'm looking for all options, not just to say, well, we can cut out the holiday pay and save, $4,000 or whatever. I'm looking for a variety. And then, once we have the options, then we can make a determination. But, like I say, if we have no options, then we'll have to make a decision without the input. So,
You want us to hand you a budget, by correct me if I'm wrong, to hand you a budget of what we propose for the following year. And then on this paper over here, we'll give you what we think we can, places that we might cut or suggestions that we can do within this budget that will satisfy the county commission.
you could say, option number one,
Right,
to do certain things,
right,
to cut the budget, to cut the payroll costs.
right.
And we estimate that it's going to cost X number of dollars, and with the benefits, that's going to translate into a total dollar of X number of dollars. And then another suggestion, if we do this, and 3 or 4 options or whatever you can come up with, and with an estimated, and I know that you can't come up with exact figures, although, it's been, Chuck, to respond to your statement about it's paid, hospitalization is paid, really all you have to do. I mean, I understand what's being said, but all you have to do is look at a person's paycheck. The amount that's deducted for the employee and/or the amount that's deducted for the health, the dependent coverage, and that's the cost as far as I know. Now, I may be, I could be mistaken. There might be some administrative costs there, but I don't think those would be.
but if it's coming off of the paycheck of the individual, they're paying for it. Where is that an expense to the county commission?
Well,
It's not
no,
on their check.
Yeah,
Well, I'm sorry. The part that the county commission pays is not on your paycheck.
so the and see, not being an employee, I don't know about this. So the employee only pays a percentage of the premium.
For all county employees, it's my understanding that the employee's health care coverage is completely paid for all employees. And it's only if you want dependent coverage or family coverage or whatever, that portion is deducted.
Okay.
So,
So then, with your health insurance plan, everyone's,
Company 3, Company 6 to respond. Route 18 south at New Milton. Transportation accident with injuries.
Information has been noticed how rapidly this.
Permission to clear.
You say,
Now, that's all we're talking about. We're here, we got our gloves on, we're gone.
Greg, I'm pretty sure I know what you
Company
want.
6, Company 3, Company 6 to respond. Route 18 south at New Milton. Transportation accident with injuries. 605.
You have no doubt.
605 and Route 1837 to responding. Route 18 south at New Milton. Tractor trailer in the ditch blocking the roadway and then
You
injuries.
come in here and you audit me. You hand me this piece of paper and say, look, this is what I found wrong. Over here on this other piece of paper, you write down suggestions on how I am to, or I should look into correcting these problems that you found in my audit. Is this not correct?
Central all responding units.
That's the
Route
same
18
thing
south
you're
at
asking
Puerto Rico Road.
on this budget.
601
You have to write down our budget and you're a separate piece of paper where we think we may cut.
They drive the tractor trailers in the ditch and then injuries blocking the roadway. All through Rose County. Yeah, well, thank you.
no, but to get back to, as far as health insurance premiums are concerned, I would think that the individual premiums are dependent upon the age
639.
and the gender. So to take the entire, let's say it's $5,000 a month, which I know is probably ludicrous, and 50 employees, you can't just divide that out.
no, and I'm sure, I mean, it's been a while since I've seen group healthcare coverage billings, but when I did, it listed the employee and the amount that was paid. Now,
Does Beth say it works that way? She said no.
She said it's a total figure that the county gets. And I think the reason being age has a lot to do with it.
well then, okay, then why would the statement that it depended upon age be a factor if it's just a group and,
I think they look at the ages before they give them a total figure, is my understanding of it. It is a total group fee that they charge.
Is
Well,
it PEI insurance? I think that's false stuff.
Okay.
I don't, PEI don't.
I'd be surprised, but I'm, you know, I haven't seen the billings, so I can't say.
I looked at those figures and it's, I was told
Tractor trailer in the ditch blocking the roadway and then injuries.
would be a problem. FICA and Social Security, no problem. I've got that.
We're talking about PEI insurance, is that what we're talking about?
Yeah.
That's on your pay stub.
Well, for the,
That's
for
the
the
part
parent
that
company.
you contribute, but that's not the entire premium.
605, 601, 606, watch.
That's not the entire premium, that's just the employee portion,
is.
right.
Mine is,
They're talking about the premium of the whole county.
yeah, I know what you're saying. They pay the premium of the individual employee. The employee pays the dependents insurance if they have it, that will show on their pay stub.
If he wants a cut, we get the gross figure that the county pays our employees.
Puerto Rico Road.
We can look at the gross figure, and that's where you want to deduct the weighted on the gross figure.
Yeah, you can come up with an amount, and, you know, and I'm not gonna sit here and and say, you're $3 off. If they break it down to employees portion of the billing, then if we have 30 employees, 40 employees, or 70 employees, divided by the 70 employees. I mean, make it easy for yourself as far as that basic coverage. Then you can figure the. But that once again, that really won't affect you all for the dependent coverage because the employee is paying.
We will work on doing our budget.
Just fixing that, 1842.
That's why everyone's got to be numbers, so I had numbers to work.
I know that that's been a response in the past. There is no breakdown, but sometimes you just have to make assumptions.
You should never assume.
Pardon?
You should never assume.
Well,
I learned that a long time ago.
If we take our gross payroll figure, and if we have to make cuts, we can work from that gross payroll figure. And I think we can cut back some hours, but if we cut back many hours, we are going to cut back on having 2 crews on duty.
We cannot not have 2 crews on duty.
I
I
agree
am
with you,
too. I have worked for almost 20 years in a doctor's office. When I started in Ritchie County, everything was volunteer. Okay, it was volunteer here, it was volunteer in Ritchie County. Do you know how many dead people I carried in to my office because we had a total setup for cardiac arrest? I couldn't tell you the number of people because the squad wasn't there.
Well, but I think Greg is saying that we're 20% of the budget, and somebody thinks that's too much, so someplace we
You
have.
can't put a price on people's
Well,
lives.
I just fixed that.
let me respond to that. And I'm not into comparing,
Fresh fixing that, 1844.
but I happen to know in, for example, Lewis County. I know that from, I believe it's midnight to 7 or midnight to 8 o'clock in the morning, they only have 1 crew, and the reason is, historically, they've had many fewer calls during that period of time. Now, you can make arguments on both sides, but we have to come up with some kind of suggestions. We're going to come up with some decisions, and
I'm glad you brought up the Lewis County thing, because do you have any idea how many volunteers they have in Lewis County?
they're all paid as well.
Well, that's not good. That's not good.
Scott,
They have a great number of volunteers in that county.
but every 5-foot tractor trailer in the ditch on that entry is about 18,000 in Puerto Rico Road.
Greg, you said we're not comparing, let's don't compare Lewis County to Stoddard County because they're so much larger than what we are. I don't think we need to be concerned about Stoddard County, what we're going to do about Foster County. And,
Well, the only reason that I brought that comparison up was to give the example of the time period.
well, we can't sit here or I don't think we should sit here and speculate on what's going to happen. You know, if the county commission comes up and says you have to cut this payroll by this amount, and it's not going to let us provide a quality care of the people in Douglas County, then I'd say we're going to have an argument with you because we can't. But on the other hand, I understand what you want.
Right.
I understand exactly what you want. And I don't think that's an unreasonable request. But on the same token, as long as we're here, we're going to provide the best possible service we can provide to the citizens of the county, regardless of what manner we have to do it in. And I think you want the same thing.
I want the best service that we can afford. And that's,
Well, does the county have a problem financially in providing what we are providing?
does the what?
Does the county have a financial problem in paying for what we are providing?
I think I probably answered that question when I said, this is my opinion, that 20% of the budget is too much, so.
Are you taking in 20% of the budget, or considering what we're paying back, $15,000 or $20,000 a month we might pay back? Is that going into payroll, is that going into the general budget, or?
Excuse me, I think that's taken into consideration, but I can check that.
The money we contribute back goes into the general fund, it's not deducted from our payroll. But there again, I got that information that goes into the general fund.
Well, common sense is gonna tell you another thing too, Greg. You know, when we get some of our regular bills paid off, like our ambulance, bank bill, this and that, other thing, we're gonna be able to pay more. Think of that to the county commission, you know. You gotta
Yeah, but
understand,
you're not talking about that happening within the next 2 or 3 years.
We gotta walk, or we gotta crawl before we can get up and walk. And we don't know, we're just like the sheriff's department, you know. We don't know when that phone's gonna ring and we're gonna have to get up and go. We don't know how much our income is gonna be. That deputy sheriff don't know what he's gonna face when he goes out there on that call. So, you know,
Well, once again,
we'll do the best we can and have you a budget that hopefully you can live with.
that's what I'm requesting.
So, like I said, you know, we'll do the best we can. If you don't like it, if we don't like it, we'll tell you.
That's the American way.
Okay.
Okay, we